President Obama addressing health care reform in his news conference earlier today, saying that skyrocketing costs are the main reason behind really wanting to reform the industry, but arguing that the reform plan will not add to the deficit. Will any of the bills currently making their way through Congress be able to accomplish what the president wants? Joining us now, congressmen from both sides of the aisle. We have Representative Bill Cassidy, Republican of Louisiana. He's a member of the GOP Healthcare Task Force and also a practicing physician, along with Representative Joe Sestak, a good friend of this program. He is the Democrat from Pennsylvania. Welcome to you both, gentlemen. Thank you for joining us.
Good to be here.
Once again, because you were with us last week, and we love the tone that you set about possible bipartisanship here. But I'll start with you, Dr. Cassidy. You are, as we mentioned, a member of the Education and Labor Committee, which took up the House Democrats' health care bill today at noon. Any progress that has been made?
Well, we're hearing testimony today, and progress is in terms of getting information. Frankly, what I've heard is I've not been encouraged by. Dr. Romer spoke on behalf of the administration and said one of our problems is that Medicaid and Medicare are bankrupting the states and the federal government, and yet they're going to increase the percentage of people on either Medicaid or on a Medicare-like program. And in their plan, they're not going to capitalize that like a private insurance company. They're going to rely upon the full faith and credit of the federal government to back it up. That's a recipe for failure. And what I said last week still holds true. Although patient-centered is rhetoric used in this debate,
right,
when you look through that plan, there's little mention of it.
Representative Sestak, I want you to respond to that, but also tell us what the plan is to avoid that sort of that emotion and concern that is what might possibly come to pass.
I believe that the president said it pretty darn well today, because when you look at the big picture, Liz, we are paying for it one way or another. And so we should bring these patients, patient-centric, into, I believe, the uninsured, the 47 million, into a health care program. We're not pushing for a single payer where it's government run. The belief is that a public health care plan option, where I believe the subsidies and the co-pays should be by those who are within there, not by the government subsidizing it, can actually keep the competition on a fair level playing field. For example, in my state, Pennsylvania, 2 insurance companies have 70% of all private health insurance policies. So I believe that, number one, we have to do this. Doing it is not an option, because we're paying for it anyway. Bring it in the system. And then if you get that early preventive care, the diagnosis early, you can bring down the cost. But second of all, I'm for the public health care option, not because I want single payer. That's not the way to go. But rather to have competition among my state and making sure that you have a fair level playing field for that competitiveness that brings out lower prices.
We've got both of your opinions and sort of ideas on this, and Representative Cassidy, I'll outline yours and we'll put them on the screen first. And among them, you mentioned that there should be vouchers or tax credits for primary and preventative care, along with market reform and tax breaks for purchasing insurance. You know, if you get caught up in more and more details to complicate it, I think maybe the worry is that it might then never happen. But by the same token, Representative Cassidy, we don't want to rush something through, do we?
Well, a couple of things. In medicine, we say, don't just do something, think. And so we have to think what works. If you look at health savings accounts, according to the Kaiser Family Foundation, a similar plan, similar benefits, similar beneficiaries, 30% lower costs when a family takes an HSA relative to a traditional fee-for-service. That works. The patient is in the center of the process. She can make the decisions that are best for her. When you make the patient cost insensitive, it's not patient-centric, at which point someone else paying, why not use more? That's when prevention works. Safeway, article, Wall Street Journal recently spoke about how they put in incentives for the patients to participate in preventive wellness programs, and their costs have gone down. Now, the public option plan has none of that. I've looked through it. They're not allowing a variable premium to encourage people to enroll in preventive services. Everybody gets the same premium.
But wait a minute, I don't know if that's
incentives.
fair, Representative Sestak, because one of the whole points of this is that you've got to have prevention, because that will then bring down the cost of waiting till people get into a horrible situation. Surely the president thought about that.
Absolutely. Look, I'm not opposed to HSAs. I think that should be an additional option you can add to if you so desire, or it can be your health care plan. But I honestly do believe that having a public health care option that has minimum standards, a woman gets a mammogram over a certain period of time, a colon rectal exam, a glaucoma exam, that you have to pay your premiums in there, and you're not subsidized by the government, but you're assisted by the government if you're lower income, helps to give us the preventive care, the early diagnosis, to where we're incentivizing the doctors beginning with the quality of the care. I don't mean that they don't give good quality, but right now, Medicare is often fee for service. How many trips do they get, do you have, is what you get reimbursed. We want to incentivize that you get X amount of money to manage the care of that individual for the quality of it. And that's why having everybody in it by a mandate, I believe, is important.
What about this? And keep your answer short because I want to hear from both of you. I'll start with Representative Cassidy. How do we get more people to want to become primary care physicians if we are flooding the system with another 46 million people? What are we going to do?
Right now, physicians have to practice like a hamster on a treadmill.
I know.
Every time Medicare and Medicaid wants to save money, they cut reimbursement to primary care physicians. They've got a fixed overhead, so they just have to see more patients. An HSA and a patient-directed health spending account, patient-centric, actually involves the patient in our health care, and that has been proven to save money. By the way, preventive measures by themselves do not save money unless they're coupled with financial incentives. There's a good New England Journal of Medicine article about that, and that's just kind of one of the things that's a little misleading in the president's statement.
Well, your last word to Representative Sestak.
Yes, this is a very important issue you bring up. Massachusetts health care plan has seen this primary care physician shortage occur up there. What I believe you need to do is to be able to give these primary care physicians an incentive that they have these patients with X amount of money, and you're incentivized to make sure that they have the care, not just for what they walk in for that day, but they're giving them a completed exam, a bone density exam, so that they make sure early on that you can get the early preventive care. I agree, there's several incentives in here, but without a question, preventive care of and by itself does give you some long-term savings. It's not the only way to do it, and I have to agree with Bill on this issue. There are several incentives, and that's the problem with government. We cannot overregulate. We have to incentivize correctly.
Well, we love to see you guys standing together, working together, keep it together. You're our team. We're going to keep coming back to you for ideas. Thank you very much for joining us.
Thank you.
Anytime. Representative Joe Sestak, Democrat from Pennsylvania, and Representative Bill Cassidy, Republican from Louisiana. We'll see you guys next time. Thank you so much. Now, bidding in an online auction for lunch with Warren Buffett is now topping around, I think, $82,000. Bidding won't close for a couple of days, but tomorrow I will sit down with the Oracle of Omaha on the day he dines with